Hello. Welcome to a very special GeoTech hour in which we discuss the idea of an immune system for the planet. I'm your host, Dr. David Bray, inaugural director for the Atlantic Council's GeoTech Center. And in this special session, we talk about the idea of using data, the internet, biosensors, and other non-obvious ways of knowing about possible outbreaks that could lead to pandemics. The idea of an immune system for the planet is exactly this, that we can get to detect things sooner in terms of novel pathogens, be they bacteria, virus, or otherwise, looking for signs in terms of biosignatures, looking for signs in terms of changes to human activity. For example, when the severe acute respiratory syndrome outbreak occurred in early 2013, it was actually preceded by about 5.5 months earlier of changes in pattern of behavior in China. For example, the price of garlic went up tenfold. If we'd been monitoring that price, we would have seen it. In fact, we did in terms of people that were watching for it. We also saw changes of patterns of human behavior in terms of what people were doing. Were they going to hospitals or not? And sure enough, with COVID-19, we saw similar things. The price of garlic had gone up. We also saw what happened as COVID-19 started to spread throughout the world. We saw less people going to work, for example, in China, more people actually going to hospitals. And that was visible through commercial space imagery. So if we fuse all these different disparate data sets together, we can actually detect outbreaks sooner that could be the signs of a future pandemic and respond faster before it gets to the pandemic phase. On top of that, we can try and sequence, whether it's a bacteria or virus, to understand its structure and what it's actually doing in the human body faster as well. This is where machine learning, this is where robust models of the biochemistry of the human bodies come into play. We've already seen in just the last few months, massive advances in terms of understanding how protein folding is actually done, and what this means in terms of understanding in terms of how the three-dimensional surface of whatever the virus or bacteria is interacts with the human body. And then finally, the third stage, which we'll be discussing today in particular, is how do we roll out the therapeutics? How do we roll out vaccines if that's necessary, or other ways of dealing with the outbreak so that it doesn't get to another future global pandemic? While we'd like to think that COVID-19 was a 1 in 100-year event, all signs point to a world that is increasingly interconnected, in which there are more and more humans on the planet. This means that the next outbreak that leads to a future pandemic might be sooner than we think. And this is why we need an immune system on our planet. Moreover, we've seen amazing advances in terms of do-it-yourself biology, including what was done in terms of what the commercial companies did with printing the vaccine, which was literally printed in a DNA, in this case, in some cases, the vaccine's mRNA printer, in which they actually told the specific nucleotide sequences that make up the vaccine. While this is an amazing advance for humanity, it's a double-edged sword. It can also be used for designer diseases. And while we don't want that to happen, while we want to see the advances of personalized medicine extend and prolong human lives for everybody, we need to recognize, just like stones that can be used to make shelter or make walls, they can also be used to unfortunately hit people over the head and do other violent things. We can't put the technology back in its box, but what we can think about is how we can actually have sooner warnings of outbreaks, whether they be natural or human-made on the planet. And on top of that, we can think about this as almost akin to a smoke detector. Just like how if you had gone back in time and told people fires in buildings are bad things, they kill people to destroy property, but we can solve this with smoke detectors that are built by the private sector that are interconnected to alert people that there may be a fire in a building to get them to safety, and at the same time alert the fire department, get the fire trucks coming, and at the same time possibly activate a sprinkler system. We can do this as well for biology and for pandemics. This is the idea behind the immune system for the planet, and I hope you enjoy this very special GeoTech hour as we talk this concept with experts around the world. Thank you very much, and as always, looking forward to the conversation as we continue to advance the idea of an immune system for the planet. Happy New Year. The new year has started off quite interestingly. We are counting down to January 20th, and hopefully then we can move forward in a more sane way from there. I would like to maybe first turn to Jim, because I know this has been a series of where we've had two conversations so far about the immune system for the planet, national pandemic observatory concepts, and how we want to move them forward. This conversation today is really going to be about vaccine strategies, not just about COVID-19, but about vaccine strategies in general, but also, right, how would you be able to monitor if genetic drift is happening and that you need to have some way to inform your therapeutics and what you're doing. So with that, Jim, I'll turn it over to you as co-host for any initial remarks before we then go to Divya and Joe for their initial discussant remarks.
Well, thank you very much, David, and certainly Happy New Year to everyone. And I know that all of us are very hopeful that with some vaccines out there that look to be excellent quality, that our lives will be substantively improved over 2021. From our perspective, the key challenge is to take the lessons that we've learned over the past months of the pandemic and figure out how to avoid incurring the public health and economic costs for the pandemics of the future, which we know will be upon us. And from the standpoint of thinking about a national pandemic observatory, I want to emphasize it's imperative to detect the global signatures of pandemics early enough for timely policy responses that can save lives and the economy. So from the standpoint of framing our discussion today, that's where I'd like to start. Thanks, David.
Thank you, Jim, as always. I would also like to remind people the chat is open to everybody. So if you have things that you want to chime in, or if you also have things you want to add, I think success for the last two meetings has been when the chat is actually going at about 30 miles per hour in addition to the discussion. So just, you know, the chat is open. With that, I'd like to turn to Divya. Welcome back. Happy New Year. If you'd like to do some initial remarks, we welcome you as the first discussant.
Thanks so much, and Happy New Year to everybody. It's lovely to be back with all of you. I would echo Jim's remarks and just state that you know, this idea of creating a pandemic prevention board it almost involves prioritizing data to create a global early warning system, and we can talk more about that again in the future, but today, maybe I could emphasize a few of the mitigation strategies that we might embrace. One mitigation strategy would be creating a global infrastructure for robust and frequent testing. And in doing this, if we were to combine it with some of the surveillance strategies that we were using for this sort of pandemic prevention board, we could start to deploy more computational techniques for doing things like tracking virus mutations, and then deploying some of our algorithmic intelligence, maybe artificial intelligence, to actually model what that might mean in terms of our therapeutic strategies. Another piece of this is, you know, as has been alluded, there's sort of a light at the end of the tunnel, we think, because of the number of vaccines that are coming online. I myself have actually received my 2 doses of the Pfizer vaccine, and I seem to have come through it without terrible reactions. But distribution has been a huge problem, and it's everything from our cold supply chain to tracking who needs to get the virus, in what order, so who are our most vulnerable people. And by the way, some of this is going to be based on the jobs that they hold and the types of exposures they experience. And other factors are going to be who they are, what their demographics are, what their background comorbidities are. So maybe creating COVID risk scores will be part of this. While tracking who gets it and in what dosing schedule, it would be really important to close the loop and gather data. And by this, I mean, who did have an adverse reaction, and where were they and why? And we could even contribute that sort of data to phase 4 clinical trials, which are ongoing trials to actually monitor efficacy. But people are afraid, and that will mean that we need a data strategy which protects civil liberties so people don't feel like they're being otherwise tracked for other nefarious purposes. So we will need to address that. And finally, my colleague Joe knows a lot about this because he has boots on the ground, but how do you actually distribute and get both information, vaccine and therapeutics to those most in need, especially when they may be disconnected from networks and maybe in places like broadband deserts or may not have access to good healthcare systems. So there's a lot of rich stuff to talk about with this group, and I'll pass it on to my colleagues. Thanks.
Thank you, Divya. Joe, so Divya teed it up for you. Recognize this is your first time giving remarks. If you could real quick introduce to the group who you are and then give your remarks, that would be great.
Yeah, hi everyone. My name is Joe Agoda. I'm the CEO of Sustento. We're a 501c3 nonprofit. We view ourselves as the nonprofit consultancy for the frontline health worker. And I want to welcome everyone to 2021. Last time we had a pandemic like this, the Roaring 20s came after it. So maybe we can reprise that and not just bounce back, but roar back. And I want to thank David and the Geo Center team for organizing these sessions. I think it's given us a place to vent and maintain our sanity during the pandemic. So as Divya mentioned, I'm leading a boots on the ground group at the front line of the pandemic with free and charitable clinics. That's my constituency. And these are safety net community clinics in neighborhoods that do not take federal money. So that's what distinguishes them from the federally qualified health centers, or FQHCs as they're often commonly known. And these groups are on the front line. There's about 1,400 of them all across the country. And I believe they have a powerful part to play in any kind of warning system. And so we've been with them since the start, and the vaccine rollout has really just followed a pattern we've seen throughout the pandemic. In the beginning, sharing information did not stop the prevention. Being a health worker didn't mean you had PPE. Needing a test didn't mean you would get one in a timely manner. And so we actually anticipated that the vaccine rollout would go quite similarly, and it sort of has. And I think at the top level, the lack of a federal leadership has really hurt at the grassroots level because everyone is doing it their own way. We're in Houston, Atlanta, all these major cities as well as rural areas, and everyone is doing their own thing and trying to figure out on their own. And so I think I would just start with that top level, which is hurting, I think, the rollout quite a bit. And we did survey about 125 of these clinics over the summer into the early fall, and their number one concern with the vaccine going into it was education. They said, are we doing enough to fight misinformation? Do we have information and education that can be understood by a general population? CDC is very jargony, very hard to understand. How do we drill this down into talking points that really our populations can understand? I would say if I want to talk about the current bottlenecks on the front line, it's all about capacity. The vaccines are there. It's the vaccinations now that are a bottleneck. And that's because these clinics are doing testing. They are doing all their other treatment. They are already maxed out. And now they're being asked to stand up community vaccination sites. And I talked to one just yesterday who just started doing vaccines. They said their clinic sounds like a clock store because all the alarm bells going off between the test alarms and the vaccine timing going off. They said there's all these alarms going off and it's chaotic. There are also a lot of clinics that are just saying no right now. They said we do not have capacity. We cannot do this without proper, financial and administrative support. And so there are a lot of clinics that are saying no to being vaccine sites. And I'll finish up my opening remarks here with what we're doing using technology to help these clinics grow their capacity. And that is allowing clinics to stand up distributed volunteer call center teams. Phone calls is one of the biggest problems. And something we've created is called Helpline SOS. It's a decentralized telephonic triage system that allows each clinic to stand up their own volunteer team. We've done about 65,000 COVID calls related to testing, and now we're standing that up for the vaccine as well. I think that's a huge data point. I know we want to explore that more. The last little tidbit I'll put out there is we also realize we need standby lists at all these clinics because people miss their appointments and the vaccines go bad if you don't use them. So we also need a way to rapidly get people to site and have a standby list because people are missing appointments and vaccine doses are going to waste already. So we need a system, a waiting list and standby list. That's also something a lot of clinics are asking for. So that's your little look from what's going on the front line in these kind of underserved communities. And I'm happy to answer any questions later, Dave, if anyone has.
So Joe, I'm going to ask you a real quick rejoinder to your opening remarks, and then I'm going to actually maybe briefly go to SJ, because I know you mentioned the topic of misinformation, disinformation around the vaccine, because that's something that SJ has tracked for a while. Joe, let's say the new administration, as part of their first 100 days, is looking for something that can amplify and improve the efforts you're doing at the grassroots level. Do you have maybe 2 to 3 things? And I know you touched on some of your remarks, but if you had to codify, what would you recommend?
Yeah, I think like public-private partnership is huge. These free and charitable clinics have kind of like access to the community. The community trusts them, they'll listen to them, but they don't have the capacity to do the vaccinations. So we have a few groups that have teamed up on testing with a hospital or with a CVS or a Walgreens, where the free and charitable clinic does all the outreach, does all the marketing, gets the people in, and then right behind them, even on site, is stood up a hospital testing site or a CVS or a Walgreens that really have the ability to do it. So I think these relationships need to be strengthened and expanded, because that really works. So that's one. I think just also funding, investments in funding, getting, so I would say an example is for uninsured individuals, testing is free. However, the CARES Act has an uninsured reimbursement system that takes time and administrative paperwork. And the clinics are saying, well, if we had a block grant, then we could do this. But they're saying we have to do it, all the work, and then reimburse for it. And we don't know, and that's paperwork and time we don't have. So they decide not to do it. So I think like upfront funding, block grant type of thing for the clinics that are going to do testing and vaccine will help them. A lot of new clinics, they go, okay, I can do this. If I'm getting the money up front and I just have to report who I did, I'll do it. But they don't not want to do it the other way around, where they have to front, they don't have it. They don't have the resources to front, and they don't have the billers and all that in place to do it. So those are two: the public-private partnership and some kind of like block grants where they could be given upfront funding to do the testing and the vaccinations, rather than having to do reimbursable, which is what the CARES Act is and funding was currently for.
Excellent. Thank you, Joe. I would like to now go briefly to SJ, because I know you've done a lot on misinformation, disinformation front. So assuming that the administration asks the same question of you, first 100 days, what can we do to counter some of the misinformation about the vaccine? What would be your thoughts?
My first thought is that life is going to get an awful lot easier very soon, because the largest source of disinformation is just about to leave the building. At one point, he was, 38% of disinformation around COVID. So that helps. I would put influencers in place. You want to build that trust. It worries me that a large percentage of people are refusing vaccinations because they're worried about the narratives that are being put out there. So I would use the government channels, and I would use people who were trusted in those channels to push consistent messaging. I would acknowledge the narratives and the fears, but I would build counter messaging, counter narratives. This is something the reality team has done very well. Very short, very informative, small posts that point out to more information. So you have all the apparatus for public service announcements. Misinformation, there are other things going on at the same time. So you have all the loyalty test stuff. So I think this will end up as being part of a larger response. There's also that one thing we think about is in terms of the risks. So we sat down and looked at the vaccine distribution and all the points in that could be affected. And we've already seen a pharmacist spoiling doses. So it's thinking about how people are affected by misinformation to damage that distribution chain. So the interactions. That's way too many words.
Oh, I think you captured a lot in there. So one of the things that's going on in the chat while you were marking is engaging local communities and thinking about, yeah. So have you seen any effective efforts that use faith communities or other communities that are already present as a way to combat some of the misinformation, disinformation? Or if you had to design a strategy, where would you start?
I have seen faith leaders starting to weigh in. One thing we looked at, 2-3 years ago now, was using existing points of trust. So you want the town clerk, the town librarian, to be putting out this messaging. You want people who can answer the questions, set up ready for that. So faith communities is a good one. But again, they've been heavily part of the misinformation too.
Right.
So you just need to build out. There's work.
Well, we definitely will be circling to USJ because I know you do a lot in this front. You do a lot behind the scenes, but we thank you for everything that you're doing in this space, and glad you could join us here. I'm going to turn from SJ now to Helen. Helen, this is your first time joining us. If you were willing to introduce yourself and maybe give some initial remarks as well, that would be great.
Hi everyone, my name is Helen Nguyen and I'm a professor of Civil Environment Engineering here at University of Illinois. And my research has been on pathogen transmission and control. So recently I have been leading an effort here at University of Illinois looking into the response to COVID. And one example is that we work with communities of migrant workers in Illinois and also agricultural workers in Illinois. Early in back in spring, there you probably all know that there's outbreak in the meat processing plant, and that really disrupt the supply chain of livestock. So we went to the communities, we went to the plant, and we analyzed the environmental condition there, and also we did a lot of environmental surveillance inside the plant. We found out that the transmission actually did not really happen inside the plant, but very likely in the communities and how people live, how people work, how they commute and all of that. So starting from there, then we have some anthropologists, colleagues here who went to the community and have been working to try to understand the community. We offer free testing, and we found out they actually, not everyone wants to get tested for many different reasons. They want to work. They don't want to find out that they are positive. They don't want to participate in contact tracing, many different issues that we found out. And then we continue offer free testing every few weeks. We go there. And now, in addition to that, we also start doing sewage monitoring in location that receive the sewage from their workplace, but also in the place where they live. So we start that monitoring network. So we try to understand that the influence of vaccination to this group. So when they will get vaccine, we don't know, but hopefully that we will have the research continuing on and try to understand how the vaccine influence these very marginalized communities in rural America.
Fascinating, and that's a really interesting sort of study of combining both the epidemiology and the anthropology. Does anyone have any questions about the approach that Helen was doing, or the comments that SJ made on misinformation? All right, well, we'll continue on. Feel free again to, if you do have something that you want to add in the chat, to circle back and do that. Actually, I'll go to Trisha. Trisha Wong was able to ask a question. Trisha, you want to put on your mic and real quick, introduce yourself and both ask your question too. That would be great.
Hi, Helen. Thank you so much for your answer. I'm with the Atlantic Council as a fellow, and my question is that is there a documented case study anywhere of what you just said? Because I think it's so rare in the public health space to understand that you need quantitative and qualitative measures to understand what's really happening. And I think this would be a great way to spread how we track this kind of stuff.
We are doing the study right now. We didn't publish anything yet.
So it's coming, forthcoming. And maybe,
Yeah.
Trisha, real quick, could you share a little bit about your background? Because I think you have a very unique background that could be helpful here as well. So, Trisha?
Yeah, so I'm a sociologist, but and I work with companies to create human-centric data strategies. And one of the organizations, nonprofits, I started with a few other people during the pandemic is Last Mile. And we created, one of the things we've done is created a public health campaign that actually targets air ventilation as a central part of the solution. And we work directly with labor organizations and scientists and policymakers and then enforcement side to bring 4 groups together to accelerate policy change, to protect workers, for indoor air ventilation, because we know that it spreads by air, but to date, we still have no public health campaign that actually comprehensively talks about air safety and ventilation. And I'll share the link to our site, but I would love to connect to scientists and anyone else on this call about it. We work with really great air ventilation scientists like Lindsay Marr to Dr. Shelley Miller, but we now are in the hardest part of our work, which is outreach to labor orgs.
Excellent. Thank you, Tricia. I'm now going to circle, I don't want to put Pete and Charlie on the spot, but I'm going to circle to Pete and Charlie for some remarks, and then to Rita. And one general question that if you have a chance when giving your remarks, just a question that has been asked about best practices for sewage monitoring. So I don't know if any of you can comment on it. If you can't, then we'll circle back, but maybe we'll go to Pete, then and maybe Charlie, I know you have a, we'll go to Pete and then we'll go to Charlie on it. Yeah. Okay.
Yeah, I mean, if Pete's okay, I can segue
Sure.
from the wastewater.
You can do that, and we'll go to Pete. Sure. So maybe Charlie, then Pete, then Rita. Sounds good. Okay.
So
Charlie.
a number of us, Aaron, Rita, Jim, myself, are active in the wastewater-based epidemiology and trying to get an understanding of what viral load, how that translates to caseload in communities. And it's a sort of Wild West, as people have talked about in other areas, to come up with the best protocols for sample handling, for analysis, et cetera, and for preservation. And just kind of maybe pulling back to the concept of the National Pandemic Observatory or alert system, we see in this space of just the waterways alone that, the thing we missed was we didn't have this in place, so we couldn't detect the emergence of SARS-CoV-2. The thing we missed because we weren't keeping samples and doing this already is the ability to go back in time and see when did it arrive. We have been seeing recently efforts around the country, around the world, to be able to track the emergence of hotspots as we're trying to do in Chicago, and to track the spread of the virus in the midst of the pandemic. And we have an opportunity over the next 12 months or so to watch how the vaccine takes, how the vaccine affects the pandemic. And that's particularly important for some of these rural areas where they're far from testing and vaccine locations. And so strategies for community level testing make sense out there. As we think about these sort of 4 stages of detecting, retroactively searching, monitoring the spread, and then monitoring the reemergence or the vaccines, we are also watching sensors start to become available in prototype form anyway, and we're probably 2 to 5 years away from good biosensors that would give us not just the ability to put stuff in the air filtration systems, as we just talked about, but also in the waterways. And so now is really a strategic time for us to think really carefully about the architecture of that, I'll just call it cyber infrastructure, that's got the intelligent sensors out at the edge and mechanisms that we need to pull the neons of the world together with other OOI and other infrastructure. So I think we are at a turning point really where a good long-term vision, we call it a moonshot, is something timely that we could make enough progress before COVID-22 and certainly be in a place before COVID-25 to really be on top of this.
Very impressive, Charlie. And actually to build on what you're saying, so we here at the Atlantic Council of Geotech Center, we're getting ready to, in the next few months, launch the GeoTech Commission report, which has got Senator Mark Warner, Senator Rob Portman. It's also got Representative Mike McCall and Representative Suzanne Delbene. So in the commission, we actually want to call out some of what you're saying. So if you were to try and maybe codify, and we can definitely follow up with you offline too, so you don't have to encapsulate it all here, but maybe what would be 2 or 3 recommendations that you would recommend we do now in 2021 to get ready for that future ahead?
I'm an excellent ghostwriter.
Excellent. So we will be following up. We do have Dr. Peter Brooks on the call. I don't want to put him on I see he's off camera, so I don't know if he's back there. But Peter, if you are there, is there any question that you have for Charlie as well? He's our lead editor and coordinating point for it. And he may be, go ahead, Peter. Yes.
Thank you. The conversation is right in line with a lot of the ideas that we've been promoting actually many of the different sections. So I look forward to anything that you write. And I would recommend send me a draft sooner than later so we can iterate.
And what we'll do, Charlie, is we'll also share with you, recognizing it should be close hold, we'll send you a copy of the report so you can see what it has in there already too. And we'll send that to Jim, Pete, and Rita as well. So now, Pete, over to you for discussion remarks, and then Rita, we're going to circle to you.
Yeah, so just following up a bit on that, what Charlie pointed out is that there are several of us who are participating here, Dan Reed and Jim and Aaron and I, who have been working on, from a cyber infrastructure perspective, what are the disruptive technologies that could help us, right? So we know that, I mean, the misinformation, all of this is a huge issue, but just from a technology perspective, could we enable new sensors to be brought online with real-time data? So much of the collection for sensors we know right now is sort of offline. It takes some projects, weeks or months to get the data products out. Being able to have real-time data paths where we're sensing water, we're sensing what's happening with species, what's happening with animal movements, all of that in real time to feed into models is something that I think is a great opportunity for us. And it only, I won't say only, it requires augmenting and integrating. This does not require that we create, $1 billion worth of infrastructure. The government has sponsored many fantastic projects that need just a little bit of additional glue in order to add new sensors, in order to set up real-time cyber infrastructure data paths, to hook to the simulation and modeling capability the nation has. So it feels close, right? It feels like this is something that we could really pull off by starting some prototypes and getting going. So we're very excited about that opportunity.
Excellent, Pete.
And one last thing I just wanted to say, David, is that we're trying to set up, we're planning a workshop to cover these topics in March. I think it's, is it the 19th, Jim? Is that what that's what we just settled on. And the concept would be an open workshop where we can really dive in to the technologies, what's required, where are the open challenges, the gaps, where can we move with wastewater detection, how would that be pulled up, and data fusion. So we'll communicate with you and the group about when we start putting that together.
Sounds great. And then we would love to, any way we can help. And I think in some respects, the timing is good because that's about when we'll start to socialize our report with the staffers on the Hill. So if we can get your language in advance of that, then we can even point to and say, and here's a workshop that's taking it now to the low Earth orbit to try and get to GEO eventually. So use the space analogy. I would like to now go to Rita. And then after that, I'd like to go to Jody if you're willing to have some remarks as well. Over to you, Rita. Oh, and you're muted, unfortunately.
Yep, good. Thank you. What I'd like to do is build on a pandemic that we were in before COVID started. We've been in a cholera pandemic since 1960. It's called the 7th pandemic. And the fact that it doesn't kill, except in those villages, remote villages of rural areas of Bangladesh and India, it doesn't come to our attention. But I'd like to build on all that we have learned and show what we're currently doing that allows us to integrate this. And what I'm very excited about is what I'm hearing. If we can glue this together, I think we've got really something very, very useful for the nation. First of all, in the work that we've done, we're currently providing for UNICEF and the Department of Foreign Service in England monthly prediction maps for cholera in Yemen that allows the British Aid Agency and UNICEF to be able to locate physicians and supplies in the precise parts of Yemen where the risk of cholera is the highest. And this gives them a 4-week forewarning. How did we do this? It's because it's based on about 40 years of work building mechanisms and tests for detecting the bacterium in this case, it's a bacterium, and COVID, of course, is a virus, in water systems to the point where we were able to relate to environmental parameters that can be measured by satellite. And this then, with modeling, provides us with a prediction of cholera. And concurrently, we're currently working with the state of Maryland. We did a pilot study measuring COVID using metagenomics and molecular genetics to detect the virus. We started in July. We were able, by working closely with Frederick, Maryland Health Department and the Maryland Department of Environment, to detect an outbreak in Frederick. We could predict it about a week ahead of time because we could enumerate the virus in the sewage samples, and there was a peak in the beginning of July, and sure enough, a week later, cases were being reported to physicians and entering the hospital. Because we're working directly with the health department, we're getting real-time results. In other words, real-time case data, not compiled data that's retrospective, that we have to calculate retrospectively. The state of Maryland has now contracted with us for the next 3 years, sampling about 50 sites in the state, sewage treatment plants, hospitals, dormitories, nursing homes, etc. And we're simultaneously expanding. This is the work of Antar Jutla, who's on the call, working together with Antar, using the cholera predictive model modified with the environmental parameters such as humidity and dew point temperatures, etc. The cholera predictive model for predicting where counties of the US the COVID would be most likely the highest risk in given times, and hopefully a 4-week or maybe an 8-week early warning. So that's just taking ground truth and prediction. But what I'm hearing the capacity of the team that's on the call right now, we can really sophisticate this in a way that can be extremely powerful. So I think there are lots of things we have to figure out, though, with respect to vaccines. Do individuals who are vaccinated continue to shed the virus? Probably, but for how long? This has to be intercalated with the data that we're getting by measuring virus in sewage in order eventually to be able to relate to numbers of cases, predicting numbers of cases in the community, as well as being able to do trend analyses that allow us to say that yes, distancing, masking, vaccines are working. So we have a lot to do, but at the same time, we have a very robust framework within which we can proceed effectively without having to start from ground zero. I could say a lot more, but I'll stop there.
Well, that's one, both very impressive, and two, if I could ask a question, Rita. So we, at the Atlantic Council, we've had some satellite and space companies approach us that are going to be launching things in orbit that are kind of ostensibly start being able to provide near real-time imagery with 15 minutes notice of anywhere on the planet at 25 centimeter resolution, potentially hyperspectral. And so I guess I was going to ask you though, if you wanted to pose a challenge to those companies, what would be a challenge that you might give them that they might be able to help with in the areas?
Well, I think we're already using satellites. Antar, why don't you speak to that? Because
that'd be great. That'd be helpful.
Yes, so we are, this is Antar Jutla, University of Florida. So we are already using a host of hyperspectral imageries for our work. We're currently relying on the visible spectrum and we're using some from the near infrareds, but not that much. But again, like there are things that we can do better with hyperspectral imagery, and then if there are data available from Maxar or other group which have higher spatial resolution, then there is a way to get information on population movement and densities and all those things. We would be happy to talk to those companies and then see what happens. We did have a operational model as we speak now. We can share the more details with you guys in in a separate discussion. But surely, like if there is an interest from private satellite companies, let us know. We would be. There are other things that needs to be done, which not in the U.S., but probably like where the viruses are coming from, how they're surviving, and then how they are basically moving in and around. So there is a way to ask other questions which rely on the high resolution satellite data sets. So let us know.
Certainly. And so happy to follow up, and maybe Claire, Peter, and I can follow up with you. One of the companies, I don't know if you've heard of this Thea Space Group, they're getting ready to launch about 112. So they may be a company to work with as well.
A quick comment is that aerosol transmission is another factor that we're very keenly interested in, because I do believe it's much greater distances than 26 feet.
So we have a we have completed a study with Prada and Maryland. We have studied this. We have sampled. Basically, we asked this question: that where is the virus, and that allows its interaction with humans. And to answer that question, we have done very extensive sampling, both in the ambient and in the built environment, and we are finding signals that the virus behaves very differently in the ambient environment and in the built environment. The HVAC systems, that were built in 60s and 70s, they're probably not willing to. They're not. They would not support much of the virus transmission. I mean, they will support the virus transmission. They will not stop it. Mm-hmm. So we have a few papers coming up, and we do our experiments do show that there is an active aerosolization of this virus, per se, like all flu viruses, but at different thresholds that happen over given what environmental conditions exist, what societal conditions exist, and then how these interact with each other. Would be happy to share some of that information with you guys as well. But aerosols are the key, not the droplets. Aerosols are the key.
Excellent. Thank you. Would like to now go, if you're willing, Phong Pham, would you be willing to do a remark? Not to put you on the spot, sorry, I usually try to telegraph, but I know you were saying a lot in the chat earlier. So if you're open to doing some remarks, we would welcome your remarks as well to the group.
Thank you so much for organizing this. And I'm fairly new with this, but I wanted to tell, Helen mentions earlier, but our group, I co-found a software called Cobalt Toolbox. And one of the things that we're trying to do is to make data collections of both qualitative and quantitative data much easier in processing that. So that's one projects that we're working on that end to try to make both the data collection and the analysis actually much simpler. And the other thing is I'm directing a program, it's a collaborations between MIT, ODI, and us that's working on with algorithm with private sectors. It's called the OPAL system that allows you to kind of send code to private sector company data that allows you to analyze the data, but actually without actually touching the data itself in terms of accessing it, but it's more remote accessing. And I think those are some of the things that I think could address some of the things that one of the panelists was saying earlier about, data fusions and integrations. I think we have a lot of data, but integrating it is a challenge. And I think it, works from both from the front end of data collections to all the way to the analysis. And then I think the other missing piece is really about the translation of those data into policy, which is another area that we're also trying to work a lot on. We've been working very closely right now with groups in the Global South. And I think that's where another areas that require a lot of work, because data there are rich, but it hasn't been harvested and processed as much. And so it's an area that we are focusing a lot, especially with our recent work, not only with COVID, but also on Ebola, the recent Ebola outbreak in the Democratic Republic of the Congo.
So building on, I mean, one, thank you for everything you're doing, and two, to building on what you're saying, there have been some comments in the chats about the need for possibly information exchanges, and so I don't know if you might be able to talk a little bit about both what you're doing and how that might grow into a larger information exchange to help with these efforts.
Yeah, the information exchange, it's a chicken or egg problems, and I think one things that I think is a big problems that I think we as a community should address is because we work in all different disciplines, but it's the nomenclatures of all of the data that we collect. I think it's a very important area where we could bring in a little bit discipline and blending of vocabularies and way we collect data and the way we share data. I think that's an area that we've been trying to push a lot, and we've been trying to build that with through some technology solutions. Like, for example, we do question banks when you collect data. We try to standardize the way you collect data, and either through a sharing of data collection instruments or agreeing on some sort of standard ways of collecting those data. So I think nomenclature will be very important for us to discuss about, especially when we talk about data fusion. And then I think the technology side too, because I think we use various different platforms in collecting data, but also analyzing data, sharing data, as we have numerous technology. But to the extent that we can actually make a seamless system that have data that migrate from one system to another and be able to put it all together, I think will be another. And I think the third one is the level of analysis and data collections. We have micro data from biological sample for sewage watering, human behavior data, we have institutional data, and then we also have policy data. And I think some of that also needs to be somehow we can layer in a way that gives us a cohesive picture of what's going on in real time. And I think that's the challenge that we have, because in human, we tend to have one perspective, but we don't have that multi-layer channels of looking at things in different levels. So if you're talking to the politician, they'll look at the high level. If you look at that institutional system, you look at institutional. And then if you look at the microbiologist, they'll look at the micro level. So it's hard to look at all those layers, but I think we're living in a place where we do need these data integrations.
Excellent. Thank you very much for the extremely insightful remarks. Not necessarily want to putting you on the spot, but Livo, first time joining us, was wondering if you wanted to share some remarks, Livo. If not, would like to then possibly, after you, go on to Gita if she would like to say some remarks as well. Livo?
Hi.
Oh, good. Yes,
yeah,
you're good.
Yeah, can you hear me? Hi,
I can hear you now.
And yeah, perfect. Thank you. And very nice to meet everybody. And yeah, I'm very glad to participate. I think we bring maybe, I bring a little bit of a slight different perspective. We are working on the kind of improving the landscape of how vaccines are, distributed and administered. So, we might not really be on the early detection side, but what we're trying to do is really trying to bring all the elements together so vaccine can actually be distributed more efficiently, removing some of those challenges that we all noticing today. So we've been working for many years to try to make a vaccine that don't need to be refrigerated by changing their formulation. And we are working now on a COVID vaccine that can be stable for 2 weeks at 25 degrees C. So they will bypass the cold chain, and it will be single dose and apply with a micro patch. So we're one of those companies that really trying to build upon the success of the vaccine that been developed really super fast, and so we're all excited about it. They have some challenges of being the first generation. At the same time, we have the chance of combining more vaccine together. So we're working on a clinical trial now that we're starting soon on combining seasonal flu or pandemic flu with COVID. So technically, you would be able to get those things shipped at your homes at the click of a button, or the government could send them in a mail. There's no refrigeration. You could self-apply. You could potentially be able to be immunized. So obviously, there's a biotech approach to solving this problem, and so I'm very happy to hear different ways that all of you are trying to look at this issue. But I think there is a big realization now that having 2 doses is a big challenge. People need to come back after 21 days or 28 days. having to be refrigerating vaccine ultra cold is obviously a big challenge. And we're seeing the rollout is being hampered by that. Obviously, we are, slow in the process, so it's going to take us at least another 12 months before we get, with a product that could be deployed. But we are trying to prevent this pandemic, but also trying to get ready for the next thing that can affect us. But thank you very much for the opportunity, David, and everyone.
Oh, well, thank you. Glad you could join us. Knowing Gita is off camera, I don't know if you're there and we'd like to say some remarks. If not, we will possibly circle back to Joe. So seeing she's not coming off camera at the moment, I'll circle first to Joe to give some thoughts as we start drawing to the close, and then to Divya, and then I'll end with Rita and Jim to wrap things up. So Joe?
I was just close with that the motivation and the people power is here. I think we just need to get organized. We need to get resources mobilized, and we're going to be able to turn the corner. And I think we got to depoliticize it. I know there's going to be like a kind of a push of like, we've got this new political power. This is going to change everything. I don't think it is. I think, for example, releasing all the vaccines doesn't change our vaccination challenge. So I think if we come together, we can end the pandemic. So that would be my final comment.
Very helpful. Thank you, Joe. Divya, and closing thoughts from you?
Yeah, I mean, as usual, this is an absolutely amazing group who are doing so many amazing things in the community. I just want to speak to the fact that I think that we are going to need good integrated data fabrics to bring all of this data together. And a lot of people have mentioned now deploying intelligence in real time at the edge. So how do we do this? How do we make all these incoming data streams interoperable and apply methods for aggregation? The second theme for me that's been coming up a lot is trust in the community. And so how do we deploy our trusted leaders on the ground to share with storytelling and narrative so that we can make everybody feel like they're part of this solution together?
Excellent. You both are being way too short. I was expecting a longer discussion, but
I could say a lot more. I'm trying to leave room for other people.
I appreciate it. Rita, okay. Well, first I'll pause because we technically are still 10 minutes out. So I was planning for people to go longer.
Oh.
Is there anything else that people want to raise before we sort of circle back to Rita and then to Jim to close for us?
Actually, David, could I then say one more thing?
Sure, go ahead. Yes.
We used to have these wonderful programs where the United States government participated with a lot of different global communities on the ground. A lot of our data gathering was done through alliances like Predict, USAID, the EcoHealth Alliance. And I'd like to see us bring back those relationships so that as we're combining satellite data and wastewater data, we can use our human intelligence on the ground too, because as we know, things are unique in different places. And those global relationships, I think, are really going to bolster any efforts we have at both sensing and at mitigation strategy.
Yes, and actually to sort of, not to put you on the spot, Divya, but I know, you've been very active working with us and that actually you are also helping us connect with AWS because AWS may be wanting to put some of its cloud infrastructure here. So I raise that because if you all have ideas for Divya and for us as a whole, she's sort of carrying the flag for us. Please send them because it may very well be that AWS, given that their stock did double in the last year, might have some money to put in this space.
And also if you have ideas or connections to pharma, any of you, I suspect that they're going to want this data also and bring them in partnership. Novartis has been funding the CATS Accelerator, Therapeutics Accelerator, so we may be able to bring some of them in too. So thanks for that shout out, David.
All right, thank you. Aaron, real quick, you made a really good remark in the chat, and then I see Charlie, did you have a quick rejoinder too, if I'm correct? So maybe I'll go to Aaron, Charlie, and then Rita, and then Jim to close.
Yes, so one of the big challenges has been that we have been all building the boat as we've gone along. We just didn't have the intelligence or capability a year ago to be prepared for this. And so we really need to think about how we get that out and to scale in the next couple of years. So to me, it's data, planning, and infrastructure. And of those, infrastructure, of course, takes the longest amount of time. So a good strategy for that is probably to build out some of what we're talking about, start integrating some of this data, start deploying it regionally or nationally, and then see what we need to do with that information.
Very well said. I think, yeah, Divya, maybe you and Aaron, I think you could take the lead on what we approach AWS on. So thank you, Aaron. That was great. Charlie, you looked like you had a quick rejoinder that you wanted to say something. There you go.
I'm always wanting to say something, but I was going to volunteer to yield my time to the gentleman from Utah.
All right, gentleman from Utah.
Oh, thanks, Charlie. I just wanted to echo what Aaron said and connect it to a couple of things Rita said as well. I think, part of the challenge is you can have two failure modes. One is not enough things going on, and the other too many things going on, but them not being coordinated. There's a lot of experience and insights in this group and in the broader community about how to measure pieces of things. It's really about bringing them together. And in the end, there are two parts to this. There is the enabling infrastructure, which is sort of the pandemic observatory conversation. And the other is the ability to build a real-time decision infrastructure that's coupled to policy in ways that is related to the trust issues. Because it's great to have infrastructure and data and even policy, but if you don't have the outreach and engagement at multiple levels, from national to regional to local and communities, translating those insights into action becomes problematic. So we have a lot of pieces. I think I'd channel what Jim and Charlie and Pete and others have said. The time to act is now, though. While it's still fresh in people's minds, because we are, as a country, a crisis-driven culture, and you never want to waste a crisis, because this will fade from people's minds, and it will fade until we face another crisis like this, and then there will be much proverbial headless chicken running around when we could have mounted a process that would have prepared us to respond with alacrity and with clarity and positive outcomes if we build on what we know now.
Very well said, Dan. I'm glad if you're open to us, I mean, we were recording that, we're open, that was just so eloquently encapsulating what we need to do. Thank you for that, Dan. And as someone like Rita and several of you who lived through 9/11 and lived through anthrax and then SARS, here we are almost 20 years later. But Rita, closing words from you, and then we'll go to Jim.
Yes. I'm really excited about the fact that we have social, behavioral, and economic scientists represented in the group. We can't really get a solution unless we have those components. And it's interesting that I tried, when I was director of NSF, to instigate some interdisciplinary science, and it was really a hard task. But here, 20 years later, we're finding that is the way we solve problems. And so with the interdisciplinarity, we can get a holistic approach to solving the problems and preparing ourselves for what may be the unknown of the next pandemic, which could be a bacterium, a virus, or it could be even some other component of climate change. But it's going to be there, and it's only with all of the disciplines integrated, interpolated, that we can get things done. So I'm really excited about this approach that we're taking.
Thank you, Rita. All right, Jim, you get to bring it home for us.
Well, David and everyone, it's just been such a remarkable conversation here today. And I feel the fact that there is a tipping point of energy where we actually can maybe get something done that's substantive and then actually makes the difference. I'd just say from a practical standpoint that as we go forward as a country, this effort it's got to be all of government. It's got to be coordinated across all of the government. And my hope is that this effort would be coordinated through the new administration's OSTP. Mm-hmm. The other thing I would say that is crystal clear to me is that Congress must appropriate new money for this effort. I'm thinking of a 10-year moonshot that includes new sensors, cyber infrastructure, data analytics, and a way to actually communicate the findings that comes from these sensors in a way that produces positive policy outcomes that can really help our country and the world. So, David, back to you.
Very well said, Jim. And again, want to underscore Peter and Claire, as you all have been interacting with Claire, we are going to share, we'll share with at least Jim, Charlie, Pete, and Rita, but if anyone else wants to get a copy, just email Claire. We ask that you keep it close hold. We are working on this GeoTech Commission report. We are in regular interactions with the staffers. They are hungry for something that they can take forward, recognizing how data and tech impacts not just the United States, but the world. So I would recommend thinking expansively about not just what we do here at home, although obviously that's clearly near and dear to Congress's heart, but what do we do also internationally? Because obviously, unfortunately, viruses and bacteria do not know borders, and what happens half a world away can and will affect us, as SARS has demonstrated, or SARS, well, COVID-2 in this case. But I raise that because I want to thank you all. This is a bias towards action, and as Pete already identified, the next step will be March the 19th. We look forward to working with everyone on that. Thank you for everything you do as positive change agents. And I'll just close with, please continue to be bold, to please be brave, and please be benevolent for the future ahead. Thank you all.